Michael Mendez said that when learned he had hepatitis C, "I didn't even know what it was." Mendez, 47, had been homeless for years in Los Angeles, and said he hadn't gone to a doctor the entire time he was living on the streets. When Mendez got a roof over his head, at the Arroyo Seco tiny home village, he decided to stop at the UCLA Health mobile clinic that rolled weekly to the Highland Park site, and soon learned about the infection that could jeopardize his life. Hepatitis C, which spreads through infected blood, causes roughly 14,000 deaths annually across the country, according to federal figures. Doctors describe it as slow and stealthy killer that can take years to show any symptoms. In some cases, the virus may clear on its own, but if left untreated, an infection can also lead to liver disease and cancer. "If it wasn't for them, I would still have it," said Mendez, who was able to get treatment through the mobile program. "And I wouldn't know what was wrong with me." Hepatitis C can now be cured in the vast majority of cases by taking direct-acting antiviral medication for 2 to 3 months. Yet only a fraction of people in the United States who are found to be infected promptly start taking the tablets. Researchers from the U.S. Centers for Disease Control and Prevention found that only about a third of patients with private insurance and a quarter of those covered by Medicaid started within roughly a year of getting diagnosed. Being able to cure hepatitis C is one of the biggest, most exciting developments in medical research in the last 15 years, and most people haven't heard about it, Dr. Francis Collins, former director of the National Institutes of Health, told journalists this fall. "The newer medications cure most patients, and the side effects are essentially negligible. So what the heck?" Collins said. "Why do we still have 2.5 million people who haven't had the chance to get tested and treated?" "Well, it's because of our healthcare system." In a later interview, Collins faulted a complicated combination of factors. Costs that led insurance programs to put up barriers. A string of steps to get treated that can become stumbling blocks, especially for people disconnected from medical care. Other experts faulted a lack of public investment and lingering misconceptions among physicians about the treatment. The virus has disproportionately hit marginalized groups, including people who inject drugs, have been incarcerated or are homeless. A UCLA study published more than a decade ago found that more than a quarter of unhoused adults on L.A.'s Skid Row were infected. Nearly half of them had no idea, the study found. Across the country, millions of people are believed to have hepatitis C, but many do not know it. One national study spanning 2011 to 2016 found that less than half of people infected with the virus were aware.